Medication. This is part of a series of short videos to explain what benign prostatic enlargement, or BPE, is. This video highlights the medication available to help treat this condition. Medication is the most common way for mild to moderate symptoms to be treated. It is usually prescribed by your GP if lifestyle changes do not sufficiently control your symptoms. There are three main types of medication, and sometimes men are given a combination of these. As with any medicine, there can be side effects. Alpha blockers, such as tamsulosin and alfuzosin, relax the muscles in the bladder and prostate, making it easier to pass urine. The size of the prostate doesn't change, but symptoms are eased by improving the flow of urine. Most side effects are mild. They can include a blocked or runny nose, headaches, tiredness, or low blood pressure, which can lead to dizziness or fainting. This medication can also lead to some men experiencing retrograde or dry ejaculation. This means at the time of ejaculation, the semen travels back into the bladder rather than out through the penis. This is not harmful, and sexual climax sensation is not affected. This does stop when the medication is no longer taken. 5-alpha reductase inhibitors, such as finasteride or dutasteride, are better for larger prostates. This medication blocks the effect of the male hormone that makes the prostate grow. The prostate shrinks by up to 30%, which makes it easier to pass urine, as the prostate no longer presses on the urethra. It can, however, take up to 6 months to see the effects on symptoms. Side effects can include lower sex drive, retrograde ejaculation, and erectile dysfunction, for which you can be prescribed other medication. The medication can also lead to birth defects in male babies, and so pregnant women should not be exposed to it. This means men taking the medication should use a condom during sex if his partner is pregnant or likely to become pregnant. And pregnant women should not handle crushed or broken tablets. Anticholinergic medication, such as teltoridine or solifenacin, are used to treat symptoms of an overactive bladder, such as needing to go more often or having a sudden and urgent need to urinate. They work by relaxing the muscles around the bladder so it can hold more liquid, which means you will not need to go as often or as urgently. Experiencing side effects is more common with these medications and can include a dry mouth, headaches, dizziness, constipation, and blurred vision. If these medications do not work for you, you may be prescribed an alternative drug called mirabegron, which also treats the symptoms of overactive bladder. However, this medication is not suitable for everyone, particularly those with heart problems or high blood pressure. Side effects can include feeling sick, constipation, fast heart rate, headaches, and dizziness. Your doctor will discuss the best medication option for you, including possible side effects. You may need to try different medication or a combination of medication to see what works best. Please speak to your doctor if the medication is difficult to tolerate. If you don't respond to medication or have moderate to severe symptoms, your doctor may discuss surgery. More information is available online, such as these websites. If you are concerned about any symptoms or are concerned about erectile dysfunction, please discuss these with your GP.